Sure, I'll start off prior to cannabis then. Basically, on all the medication that I was on, the strong opiates, I was very, very sedated. I was drooling a lot of the time. I was slurring my words. A lot of people that I spoke to on the phone thought I was drunk when I was trying to speak to my kids' schools, for example. That caused some unwanted attention there. I wasn't able to think properly. My memory was suffering. I had to pull out of an open university degree that I was studying at the time. So yeah, it impacted me a lot. I wasn't even able to communicate with my kids properly or help them with the homework. And the pain wasn't being satiated adequately to be able to function. And that's where medical cannabis helped. Not only did it help me when I was coming off other medications, I didn't experience what I could call withdrawal symptoms from coming off opioids, and I can only assume that's related to the medical cannabis because I've never had to come off that kind of medication before. But I was fortunate that it was a smooth transition. I've gradually titrated the dosage of cannabis along with my clinician and with my GP as well, who's also become involved in helping with my medical cannabis prescription, and I've gradually reduced some opiate medications, increased cannabis, and I've come to a good level at the moment where I've got two flowers that I use and an over-the-counter CBD to treat my symptoms, and at the moment it's going extremely well. I'm able to interact and function more in general day to day. My kids see me more. I feel like me again. I'd lost myself for years. Absolutely years. I used to be involved in a lot of charity work and things like that, and being able to get involved with an advocacy group like PLEA now, where I can really try and throw myself in for any hours that I've got available, that I'm not in pain. Obviously, still suffer quite badly, but I'm able to put that back now into the community, and I feel like I'm valuable to society again. Even in a small way. And who knows if my condition keeps improving. I'm hoping to get back to physio now because that wasn't working before, but maybe it will now. And hydrotherapy was great, going swimming as well. And I cannot wait until after lockdown and giving that a try again. And I may be able to get back to work. It's phenomenal. It's all thanks to medical cannabis.
What a great story, Matthew. I can relate to so much of what you said completely. Cannabis has given me my life back. If you can imagine, when you have back pain, a lot of people don't see it. It's sort of invisible. When you have a damaged brain, it is invisible. I look fine on the outside. If you talk to me, I can engage. But what you don't see is how hard it was to get to the point where I am now. And cannabis has allowed me to do that in a way that helps other people, I think. I feel like I make more of an impact now after brain injury and discovering cannabis than I ever did as a pediatric nurse. I feel like people need to have hope, and I had none. I was literally planning to die. And it shouldn't have to take someone to get to that dark place before they find relief. And if I can just help one person one day try this plant, then I feel like I've made a difference in their life. And then I've done a good thing for the day. My personal satisfaction comes from introducing others to the plant, those that have never found it and were like me. I mean, I was really closed-minded to it. And the difficulty in the US of each state having different regulations is a huge issue for patients, for consumers. We can't just cross state lines with our medicine, and that's just so wrong. New York State has recently legalized adult use, and that's going to be awesome. But I don't want to see the patients suffer. I don't want to see the patients be forgotten and just be so focused on the rec and making money that we forget about those reason this plant is being offered as an adult use option. It's for better access, more safe access. I'm part of many advocacy organizations, and a lot of people reach out to me on a daily basis just to say, hey, your posts really helped me, or thanks for letting me know I'm not alone. And I think if we can all just stop being judgmental and just be kind and try and really empathize with other people that don't have the real answers, and be your own advocate. Like I said, I wasn't introduced to cannabis via a doctor. I was introduced to it via a billboard. And, I think it should have not come to that point. It should have been a much sooner introduction. And so if I can speak to the medical providers out there, it's really start to learn what an endocannabinoid system is, really study and understand there's real medical value here, whether they smoke it, whether they eat it, whether they tincture it, put it on topically. There are multiple methods of utilization of cannabis, and it's about finding your sweet spot and improving your quality of life. And that's probably the biggest message if anyone can take away from me today is be your own advocate and be willing to try different types, methods, and find what works for you.
Absolutely. You made a couple of good points there that resonate for ourselves in the UK as well, because it is a last option. It really is. The doctors, especially just GPs, general practitioners, that are the first doctors that patients go to in the UK, generally know nothing with regards to medical cannabis and won't go near it. My own doctor at first was extremely reluctant to talk about it at all. And it was the same from a pain clinic, anaesthetist, and eventually spoke to a neurologist with regards to a different condition, and a specialist in the back pain centre. I was sick at the time, and none of them go near it. And eventually it was through a local MP, I managed to contact another patient, and they put me, on the right track towards contacting a clinic. But it should not be the last option, and you have to have at least 2 failed treatments in the UK before it'll even be considered. And yeah, it should be a primary option for people to give it a go, because it's proving more and more, as results will show, in the UK as drug science releases them, especially from Project 2021, which is a huge register in the UK at the minute. That once the results come back showing how good it is at treating symptoms with so few side effects, so I should say, then people will start to be less fearful of it, and hopefully try and promote the fact that it should be a first port of call.